All right. Hey, everyone. Thanks for joining. I got Dr. Greg here. He's the founder of Intrinsic Supplements. This is the beef liver that we carry here. And we're just going to talk all about beef liver today. And hopefully you guys get value out of this conversation that we have. So thanks for joining, Dr. Greg.
Yeah, my pleasure. My pleasure.
Well, so why don't you just start off with how you got here to founding the beef liver supplement we carry, grass fed, grass finished, the high quality supplement. But how did you get here? What led to this?
Yeah, it definitely wasn't hey, gee, I have a great idea. It was one of those I see a need and I think maybe yeah, maybe I could fill that need. So when this is 3 years ago now, just over 3 years ago, I started practicing on my own again, and I want the best products for my patients, and I
Yep.
know you want the same for yours. And I ran into a snag when the company I was using said we're no longer going to be providing wholesale options.
Yeah.
And I don't want to name names, it's not about that, but basically I was faced with a decision to make and said, man, both for the people that I work with and other docs that I know, um, is there enough of a need? If I can find the best quality product, can I
Yeah.
bring it to the table to help serve people still?
Yeah.
And lo and behold, we were able to find it. We were able to make it happen. And fast forward 3 years now, it's pretty crazy to think it's been 3 years, but
Right.
not compromising on the quality, number one, and realizing clinically, and I know we'll get into that. So,
Yeah.
just so many reasons to use it that it was enough of a reason for me to turn it into a business.
Yeah. I would say beef liver is becoming more and more popular. More and more people are hearing about it, seeing about it, reading, social media stuff. As far as sources of good quality glandular product like a beef liver like this, even in as a practitioner looking at the brands, even Standard Process, which I'm familiar with, use 15 years, they don't really have just a straight beef liver product. Might be a blend of things. Heart and Soil is a great company, great source of things. Does Heart and Soil have a straight beef liver? Do you know?
So Heart and Soil does not. They have a lot of different blends, so they
Yeah.
combine different glandular parts. One of the biggest ones out there that really was the forefront, the pioneer, was Ancestral Supplements,
Okay.
which is where Liver King originated. So for anyone who's
Oh,
heard of him,
yeah.
that was his baby from inception. So those are probably the two most well known. But yeah, there's other companies popping up all over the place. And the thing that I really wanted to make sure that I did was I kept it and have it exclusively wholesale only. So that
Yeah.
way docs can get it for their clients. They know exactly what they're getting. We're not on Amazon. We're not trying to go big box retail and water down the product. We're
Yeah.
really trying to keep it exclusive for being able to keep the quality as high as possible. And I'm not saying Ancestral and Heart and Soil aren't. It's just I wanted to make it specific for the provider to be able to utilize.
Well, I think it's the best product that I have found that's just pure beef liver, grass fed, grass finished beef liver. Heart and Soil, I love Heart and Soil. I've even used their joint strength complex. They have a blend organ synergy one. Um, Love them. They don't have a straight beef liver, which I just thought was interesting because I usually give that as an option, a recommendation
Yep.
place to go if people want to go shopping. Um, what would you say for people shopping around for beef liver and looking at beef liver on Amazon? What would your tips be for them in looking for a good quality beef liver supplement?
Yeah, I mean, I would say number one is going to be, where is it coming from? Gold standard for any sort of, whether it's liver or any other glandular type product, New Zealand is the gold standard.
Yeah,
Argentina is a close second. They're very common. There are some places starting to source in the US, but it's just not very common or popular. And, just
Yeah.
for what it's worth, not to get too far off on a tangent here, but we know that there's a lack of optimal farming practices happening in the United States.
Yeah.
In a country like New Zealand, it is required that there is no pesticides, no hormones, grass-fed, grass-finished. Like that's standard. They don't even have to force people. That's just what you do. And
Yeah.
so if you're getting a beef liver or a glandular that is coming from New Zealand, it has to be the highest quality. And so that's the minimum that I would recommend someone look for. Obviously there's going to be a variety of other things, from how many milligrams per capsule, etc. One thing that's nice about the Intrinsic is we're able to get 3,000 milligrams in 4 capsules.
Yeah.
A lot of other companies are using 6 capsules to get the same amount. 3,000 milligrams, kind of the standard daily dose that for most people, that's the normal or the average. And
Yeah.
so anytime you can only take 4 instead of 6 is a benefit, right?
Right.
But yeah, otherwise, I mean, the big thing is where you're getting it from.
Yeah.
And most of the others, yeah, are going to be pretty standard across the board as far as other quality items.
Yeah. And the capsules aren't bigger. So
Correct. That's the key.
they're
When I
not
when I
that
heard
big.
that, when I was putting this together and I heard that the first time, I'm like, oh boy, here come horse pills. Nope, they're
Yeah.
they're actually not. They're the
They're
exact same size. Yep.
normal size, normal
Yep.
size. How about we get into the benefits of liver? I know the kind of the big ones is, and I want you to talk about this, the philosophy of like supports like, and taking liver, how that helps your liver. But you can take this any direction you want to, Doc, but detoxification, you even talk about methylation support with beef liver, hormonal conversions. I know each of these might be its own topic, but I think people are interested in how beef liver helps our bodies. And maybe just start with the like supports like, and how we support our liver.
Absolutely. Well, I think first and foremost, we have to admit that if we polled the entirety of the world, 99.9% of that audience has less than desirable liver function. So we're already starting at a starting point where you need liver help, right? And that can
Yeah.
mean different things to different people, like you mentioned. So with that being said, the whole idea of like helping like, how like supports like, what does that actually mean? Well, if you want a healthier liver, one of the best things you can ever do is consume liver. It's one of the most amazing aspects of our body, and being able to use nutrition coming from animals, that you're able to get a lot of the building blocks to help repair that damaged organ by consuming that same organ. So for instance, not to, again, to tangent too far here, but to use the example of the heart, most people have heard of CoQ10 and say, oh yeah, I take CoQ10 for my heart. Well, did you know that the heart is the number one place that CoQ10 is actually stored? And so same thing happens with liver. If you need certain vitamins or minerals or nutrients for your liver to actually help it heal and repair, the best source for that is actually liver. And
Yeah.
so it's just a really, really cool concept. And certainly that can spiral into some of the other areas that we'll talk about. But just, and I always tell people, yes, I have a supplement, but I'd rather you eat it first,
Right.
right? But that's the sell, right? Who wants to?
Yeah.
Not many people are, yeah, go, let me go eat it, right? So okay,
Right.
we'll take these 4 capsules a day, right? So it's
Yeah.
another thing. I would much rather someone not buy my product. I'd rather someone, even I love you, Dr. Ryan, but I don't want someone to buy your liver. I'd rather them eat it. But
Yeah.
we know how many people aren't going to do that, and that's hence the need for the product.
Yeah. I think we educate as practitioners of where to get it in our food sources first. Try to get it in there first. Even collagen, trying to get that in your diet. Well, how much bone broth are you eating every day? How much chicken skin are you eating every day? Eggshell membrane are you eating? And when's the last time you even ate it, right? So people not getting it on a daily basis means they're deficient in it, right?
100%. Well, so one of the fun things that I always love, I'm a nerd, that. So, I could be very happy sitting around reading a textbook. Like that doesn't bother me any bit. So,
Yeah,
if I open up a nutritional biochemistry book and I start looking at different vitamins like vitamin A or B12 or folate or you name it, the list goes on, and it says what is the number one food source of this vitamin or mineral?
yeah,
Liver is just the number one for so many different vitamins and minerals. And again, it's staring you in the face, but most of the time people prefer other alternatives that are way less optimal when it comes to getting a lot of those vitamins and minerals. And so I actually, even on the label, I have it coined as nature's multivitamin for the reason saying you are getting so many vitamins and minerals
right.
through that capsule that even the need for your traditional multivitamin is almost non-existent, which is again a beautiful thing because I don't want anyone taking anything more than they need to.
Right. Well, we have the philosophy that we supplement where we're deficient and what we're not getting in our diets and being strategic about that. And sometimes in life we have needs greater in certain times of our life. Certain parts of our body might need more
Yeah.
need. If you have a joint injury, you might have to, target that area of your body in that moment or for recovery. Um, it's interesting to think about all the ways the liver affects our life and our physiology. One common thing that we approach liver with is with our hormones. And when we do Dutch testing and hormone testing with the blood and we see hormone issues, can you maybe explain how and why the liver is such an important factor with our hormones?
Yeah, we're trying to keep this as simple as I can, knowing
Yeah,
obviously this can go pretty deep.
yeah,
For any of your audience that has ever done a Dutch test with you,
yeah,
if they haven't, they need to. But
yeah,
when you're looking at a Dutch test, on one of the pages, when you're starting to look at some of the hormones from testosterone, progesterone, estradiol, some of the major steroid hormones,
yeah,
on that page, you're going to see a bunch of arrows. Like the whole page, you're going to see the number, and then you're going to see arrows all over the place.
right.
Everywhere that you see an arrow is a pathway associated with the liver. Your liver is responsible for converting all of those hormones into different hormones.
Yeah,
And so if your liver isn't working the way it needs to, guess what your chance of having optimal hormones is?
right,
Literally 0%.
right.
So, I mean, some of us can get away with more than others, and that's again, different discussion for a different time. But really, when it comes down to it, without proper liver function, your ability to have optimal hormones is non-existent. And
Yeah,
so that to me is again, if you gain nothing else from hearing that, I think every single person on the planet wants better hormones. I
right.
don't think anyone's going to say no to that. And
No.
so you got to make sure your liver's doing what it needs to do.
Yeah, I mean that it's the building block for energy, right? Vitality. The liver is your main is one of your it's your largest organ in your whole body.
Yeah.
Internally, it's the largest organ.
Well, and you think about how many, and I'll pick on the women specifically here. You think about all the fertility issues, the cycle issues, the mood issues, you name it. All of it can be tied back to the liver. And it's just such a foundational piece to the equation that I hope you don't miss it. There
Right.
can obviously be a lot of other variables that exist from person to person, but that's one that is constant, that you and I see all the time.
Well, there's two categories I think viewers would be interested in with what liver gives to you. Liver is a good source of vitamin K2, correct?
Yeah, it's really any fat soluble vitamin requires liver in order to your both liver function, and certainly you can get it from liver direct in order
Yeah.
to help support those.
So with vitamin D, we know that K2 helps with the absorption of D and the effectiveness of D in our bodies. And so if you're getting liver in your diet every day, taking a beef liver supplement like this, that's probably enough K. You don't have to go buy a separate vitamin K to add in with your vitamin D. Would you agree with that?
Yeah, I mean, most of the time, and here's my best answer instead of just saying yes and leaving everybody
Yeah.
hanging. So
Yeah.
labs don't lie. Like
Yeah.
when you run a lab test and you're measuring 25 hydroxy vitamin D, which is really the primary blood marker to determine vitamin D levels,
Yeah.
you can see that level beautifully climb if it's low by only giving D3 without K2. Happens
Yeah.
all the time. So how
Yeah.
do you explain it? Well, they need K2, not if you're getting it from a bioavailable source that doesn't require you to take anything more than you need. And I
Right.
think that's the key to so many things is, we have this fear that we're not doing enough sometimes. But
Yeah.
by not doing enough, we actually end up doing too much. And it's actually harder on our body because guess what has to deal with too much? The liver. So you
Yeah.
actually stress out your liver by taking too many things. You can get something called polypharmacy, which is too much of some outside substance that your body has to deal with. Yes, that can be true for medication, which is, side note, if you're on a medication, you have to be on beef liver for what that's worth. But you can
Yeah.
also get polypharmacy from taking too many supplements
Yeah.
because your liver has to deal with that too. And so it can go both ways.
Well, I think that's the struggle for the general population is what supplement should I be taking? Because if you look at any supplement, there's a benefit associated with it. And so there's thousands and upon thousands. So, and you don't need to take, that's part of our job is helping them,
Yes,
helping people understand where do you need to supplement and where can you get away with not supplement. So a lot of times when I start working with clients, I'm telling them to get rid of certain supplements, stop taking those. It's saving them money because they're not buying
absolutely.
those products and kind of dwindling it down. Some people are just we're taking less supplements.
Absolutely. Well, we tell people all the time, like, how do you know what you need to take? Look under the hood,
Yep,
get tested,
get
right?
tested.
Run the test, and we'll be able to tell you what you need.
Test, don't
Other,
guess.
yeah, I mean, otherwise you're just shooting in the dark and probably wasting money, and not
Yeah,
probably. I know you're wasting money,
yeah,
and so just you take what you need, not anything more.
yeah, and that helps you know what you need. The last
Absolutely.
one associated with liver that I think a lot of people would benefit from hearing is the anemia iron category and how much iron is in liver, and that if you and for women with their cycles and periods and
Absolutely.
being low on iron, would you have anything to add in that category for
Yeah,
people?
I'll kind of give you a multi-answer here. So number one, let's just kind of define anemia. So typically anemia in the most simple terms is iron deficiency. That there's multiple types of anemia. And again, without getting too complicated here, let's just say we're making a blanket statement that anemia equals low iron.
Yeah,
One of the hardest things for our body to use and absorb is direct iron. And so taking an actual iron supplement for most women that I've ever worked with, it can really wreck your GI system. It is really hard on the stomach. You can get nauseous, etc. And our body actually is lousy at absorbing it. Why? Because it's a metal.
yeah,
Versus in liver itself, you're getting what's called heme iron. And so what heme iron is, that's the most bioavailable form of iron. So no, you're not getting as high potency as you might get from a direct iron supplement, but you're getting it in a form that your body's actually going to be able to utilize.
yeah,
And even the function of the liver relative to iron storage is critical. If your liver isn't working normal, you're never going to store the iron. So another marker that you and I look at quite frequently is ferritin,
yeah,
because if you're not actually storing the iron, who cares what your actual iron levels are?
yeah,
So I say that facetiously a little bit, but hopefully my point's coming across that you want to use a form that A, your body's going to tolerate well, and
yeah.
B, that at the end of the day, it's actually being used and absorbed appropriately.
Yeah, it's a great explanation, I think, of what it means to be bioavailable or taking a bioavailable source of something. I think, yeah, Gary Brecka is really popular on the internet. He's a great communicator, great speaker. But some of these terms that are thrown out there, I don't think everyone understands what they actually mean, like bioavailable. So thanks for explaining that.
Yeah, we'll even, I'll throw this word out there, methylation, right?
Right.
Huge word, buzzword now. What in the world does
Yeah.
it mean? Well, it's a
Yeah.
specific liver pathway. And again, you want to support methylation. If you're not taking beef liver, your methylation's not going to be optimal. Why?
Yeah.
Because the major vitamins and minerals that help support that liver process, number one source is liver. And so you can spare yourself a lot of money and banging your head against a wall. Things like MTHFR, etc. Again, all these things that are just, what do I do about that?
Right.
Well, the simplest thing you can do is just keep your liver healthy, take liver to make sure you're getting the nutrients you need. And if you do need to get tested, sure, go for it. But at least start with the obvious.
Yeah, I think helping people, one of the best things that we do is help people understand what tests are worth the money, what tests are the right tests to be taking. And at least in my clinical experience of working with people for years now, is I'll meet people that are looking for help and they've had hundreds of tests over the last 8 years, but they're not necessarily the right tests, or they did one 7 years ago and another 3 years ago, and you don't really have a clear picture of everything you need to make decisions and how to help that person. And that's what I think the beauty of comprehensive blood work, getting everything you need in the blood, or a Dutch test where you're getting a lot of the beneficial information for your sex hormones and your cortisol and your organic acids, or a GI map for your gut. You're getting as much of the right information as you possibly can. So I think that that's one of the most helpful places to start, is just knowing what tests are the right tests. And then, of course, you get into the details of how to interpret the test and what recommendations are you given from those tests. I think are real critical.
Yeah. Well, it just gives you a direction versus you might be incredibly educated where you've done the research, you've listened to a lot of people that are right on, but you're still sitting there saying, well, me, like what's specific to what I need?
Right.
That's why working with someone directly is still going to be the best way to go.
Well, one question I had that I think would be really helpful for all of us would be just, you hinted at it earlier, of uh, a lot of people have less than desirable liver health. And so what is the standard ways to know for people to know, or how do we test for liver health to know? I know some people, push on your liver if it hurts. Well, your
Yeah,
liver's probably
I
not
hope
happy.
that's not going to be the case, because if it
Yeah,
is, you've got a really bad liver, right? But
yeah,
that does happen. It can get that far gone. I mean, the
yeah,
most basic thing you can ever do is look back at labs you've probably had done for whatever reason and start looking at what's called a metabolic panel, um, markers called ALT or AST. They're liver enzymes that give you an idea of how much stress is your liver under. Um, Fatty liver is huge nowadays. So looking at blood sugar, insulin, hemoglobin A1C, all of these metabolic markers are going to give you a very clear indication of liver function. We talked about the Dutch test. You're going to know how well your liver's working based on how your hormones are converting.
yeah,
So there's a lot of different pieces, different ways to assess that, which is why, again, instead of just going out and running every test under the sun, you really should, work with someone like Dr. Ryan that can pinpoint, all right, what is it that we might have a suspicion about, so we can actually test the more appropriate area that you need to look at.
yeah.
But I mean, there's certainly a lot of ways to assess it. Some very direct, some a little bit more indirect, but in some form or fashion, every test you're ever going to run is going to show you the outcome of your liver health.
Yeah, I think so. The metabolic panel would be a blood test, just so
Correct.
people know where you're getting that. And then the Dutch test, I don't think we explained, as a urine test.
Yep.
So that's a nice test that can be done from home, sent directly to the lab, and then we can get those results and interpret. But so blood and urine are those two tests. Um, what was the other thing I was just gonna gonna ask? As far as like liver detoxes go, how would someone know if they would benefit from a liver detox, or should they do a liver detox in conjunction with talking about the liver?
100%. Number one disclaimer, I don't think anybody should jump immediately into a liver detox without having some sort of either background knowledge of lab values of certain factors or having someone specifically give them a plan to follow. There is a lot of bad liver detox. There are a lot of bad liver detoxes out there. Like,
Yeah.
just be careful is kind of my disclaimer. Now, to get a little more specific, who should do it? I would argue that every single person in some form or fashion should do it.
Yeah.
Again, under appropriate guidance.
Yeah.
But every one of us, though, here's the key. Every second of every day, our body is detoxing.
Yeah.
So we're never not detoxing. It's just sometimes we need to push the envelope a little bit and try to stimulate things a little bit. And
Yeah.
so why that's the key is I am not a fan of let's go guns blazing in a detox and just try to just crush the system and
Yeah.
shock and awe things. Please don't
Yeah.
do that. We should do things that gently nudge it, gently upregulate it, and do it in a way that is very calculated so that way it will be tolerated. You know,
Yeah.
it's not a badge of honor if you do a detox and you feel like you're going to die. Like that's not, don't pat yourself on the back for that. That's an inappropriate detox. And
Yeah.
so we just need to be aware of this is a lifelong process, daily, minute by minute, second by second process that needs support, not something that you win a race for a 7 day or 30-day process.
Yeah.
So anyway, yeah, it's a little bit of a pet peeve of mine if you can't tell, just with
Yeah.
how it's done incorrectly.
Well, and I think it goes back to the philosophy of health that we have, that I mean, life is more like a marathon than a sprint. And
Absolutely.
we would prefer to encourage consistency in our health rather than just a sprint for a month and then you just fall off because it wasn't sustainable, and you don't actually create any long-term benefit to your health.
Correct. Absolutely.
I think one last kind of topic I would like your thoughts on is when you are just how the liver works with toxins when a toxin comes into your body, how the liver identifies a toxin and wraps it up in a fat cell and stores it, that physiology. And how or the liver identifies that toxin and breaks it down and says, hey, I can handle that, break it down and release it, that sort of thing. Anything on that realm? I think people may not, even in the weight loss world, realize the amount your liver is doing as it's breaking down fat cells and getting rid of toxins in the process of weight loss and fat loss.
Absolutely. Yeah. So let me start kind of even with a little bit of physiology just to reiterate what you just said. So when we have a toxin enter our system, our liver has to deal with it.
Yeah.
And it basically has two choices. Either A, I can handle it, and so I'm going to put it through the proper detoxification channels, and I'm going to eliminate it.
Yeah.
And the major ways of elimination are sweat, urine, and stool. And so if you're efficient at getting rid of toxins, ideally the body is going to get rid of it and not store it. But
Yeah.
if you're inefficient, it has no choice but to store. And that storage is going to be in the fat cell.
Yeah.
And so why that's important is anybody with weight loss goals, or they're just like, all right, how do I make some change here? Well, you have to make sure that your toxic load is reduced and your liver is more efficient. Now, the danger, and again, why not go into just a full-blown detox? You start releasing toxins that your body isn't capable of eliminating, you start recycling toxins. That is devastating on our body.
Yeah.
And
Yeah.
so don't try to go, blow up your fat cells and release a bunch of toxins if your body can't actually get rid of them. So a lot of
Yeah.
times you will not lose weight until your liver's more efficient,
Right.
for a good reason, for a protective reason. And so these are things that we need to keep in mind. The body is very good at adapting and dealing with all the garbage that we throw at it.
Yeah.
And when we eliminate roadblocks, then we can see results. If you're not getting results, that means there's still roadblocks.
Yeah. Well, I think it's important because a lot of the world is, wanting to lose weight, trying to lose weight. And I see that done so unhealthfully all the time. Patients losing weight, and that's the win, that's the goal. They want to lose weight, but they're not eating enough protein. They don't have any cartilage in their diet. They haven't supported their liver, and there's so many other factors than just, hey, let's lose weight, let's lower the calories, let's burn these off. And so just trying to teach the world, teach clients that I work with of the healthy ways to do that, the effective ways to do that, that are long standing. It kind of goes into, you said that we detoxify through sweat, through pee, through poop. So it would make sense, even just to be healthy, even if you're not trying to lose weight, that you are sweating, whether it's a sauna or exercise. Getting your body to sweat is a healthy thing. Replenishing electrolytes and replenishing magnesium if you sweat a lot, but also drinking enough water, clean water, so you're actually peeing regularly. And I think one thing we talk about in the gut health world and hormone world is, especially if you do a cleanse of any kind, of parasite cleanse of any kind, you want to make sure you're pooping.
Yep.
And not everyone knows 1 to 2 poops a day would be a good thing, that's normal. There's so many people in the world that I come across. I mean, they don't poop for 2 or 3 days, or they poop a couple times
Or
a week.
longer, right?
Yeah.
Absolutely.
And so if you're wanting to lose weight, you're wanting to detoxify in any sort of way and support your liver and systems, you want to make sure you're sweating, you're peeing regularly, and you're pooping.
100%.
Last thing, I think we covered a lot. Is there anything else you wanted to cover today with
No,
liver?
I think we hit a pretty good swing at this. So
I think this will be super
that was
helpful.
good.
I would say of the beef liver supplement, even on the bottle, I think itself, somewhere I read that if you're not used to taking beef liver, you might want to start with 1
Yep.
capsule
You
and
can start small and gradually increase. Yep.
gradually increase. Is there anything as far as dosage where you
Yeah, I
give
mean, I
feedback?
guess for the person that is over concerned, yeah, start with one. Take it for
Yeah,
a couple days. That's okay. Go to two and work your way up to four. I mean, by all means, you can go straight to four. Now, what's the negative reaction? It's detox symptoms because even just by taking beef liver, you're going to start to wake things up. And so, what are detox symptoms? Headache, just kind of feeling off, maybe more fatigue, some of those types of things. If that does happen, certainly reduce dose and gradually work your way back up. And
yeah,
you don't have to do it with food, but most people do tend to tolerate a little bit better with food when there's something else in the system.
yeah. I think just helping people know the general, guidelines around it. There are times where I've increased dose beyond 4 capsules
Yep,
in
there's
cases, but
definitely a time and a place. Yep,
time and place, yeah. But I think maybe working with someone like you or I to guide them on that journey is helpful rather than going it alone and guessing. I always say if I
100%.
was an engineer or did something that wasn't in this field, I wouldn't know half or a tenth or a hundredth of what I know. So just that's the kind of people we're helping, the people that don't know physiology and how to go
100%.
about this healthfully. Well, thanks for coming on and giving us insights into liver and the grass-fed, grass-finished liver that you started, and we use it all the time in our office.
Yeah, it's my pleasure. Yeah, again, I'm doing it because I believe it's necessary clinically, number one, hands down, and that's it. And
Yeah,
if someone isn't doing it, again, I think you should definitely consider it. And certainly, Ryan, I know you use it all the time, and
yeah,
I appreciate that.
yeah. All right, man. I'll talk to you later.
Sounds great. Thank you, sir.